Hi, I'm Lawrence Bergstrom, registered osteopath of over 25 years experience and a former NHS osteopath for 10 years, and I'm also an advanced trained non-surgical spinal disc specialist. Now in this video we're going to talk about the misnomer or the myth of slipped disc. So we're going to talk a little bit about what that means and in reality what they actually are. So people talk even today a lot about having a slipped disc. Sometimes it even filters into medical language where you might even see a doctor and the doctor will diagnose you with a slipped disc. Well, I want to be a little bit more transparent about what that means and what that means for you, and also how we manage these things. So when we think of a slipped disc, there's this misconception that there's a material that has moved out of position, okay? Now, spinal discs can't actually slip about, and I'm going to show you on a model now. I'm going to just explain a little bit about the anatomy and show you on a model what it actually means. So if I take this model here, and I'm just going to give you a little bit of basic anatomy. So this is a vertebrae or a bone. This is another vertebrae or a bone. And this in the middle, this spongy structure, is known as the disc. Now, the disc is made up of fibrocartilage. So it's rings and rings and rings and rings of fibrocartilage. And in the center of the cartilage, you have something called the nucleus pulposus. And the nucleus pulposus is made up of protein molecules and glucose molecules. So it's like a thick custard or a yogurt that sits in the center here. And then surrounding that, you've got rings and rings and rings and rings of fibrocartilage. And that comprises the disc, okay, which is this structure here. And this disc should be about 80% fluid. And then you have protein molecules, glucose molecules. You also have the fibrocartilage as well. So it forms a sort of a lattice work of a structure. And then really, in part, it's a shock absorber. Now, what happens when you injure a disc is over time it can degenerate, or if you have a massive strain to a disc, it can be damaged immediately and really severely, because this fibrocartilage can, in severe cases, be very badly torn, or almost sort of completely torn through. Just the way you could tear a ligament or a tendon badly, well, the same thing can happen to a disc. Now, there's a space here, and if you can see this window, we call it an intervertebral foramina. So that's a bit of a mouthful for you. So for our purposes, we'll call it a lateral canal or a lateral window. Now, when we talk about a slipped disc, what in actual fact happens is some of this disc material starts to encroach and press into this space. And why is that important? It's important because there's a nerve that sits in there, and you have a pair of nerves, one nerve for each side. So when we're looking at the vertebrae here from the back, you have a nerve comes this way and a nerve comes off this way. So if that disc material slides back and presses back into that canal sufficiently, it will compress a nerve. And then if it's in the neck, you can have pain down your arm, for example, down into the shoulder. If it's in your lower back, then typically you can have pain somewhere down your leg and or into your foot. Now, these discs can't physically slip about because they're heavily tethered by ligament tissue, really, to the bone above and the bone below. But the reason slipped disc can be used is because if you look on an MRI image, when you look down the spine, where you see the disc bulge at the level that's affected, it looks as if material has slipped into the space occupying the nerve. But in actual fact, it hasn't slid in there, okay? So it's not, hasn't, physically slipped. And the reason this is important to be aware of is if this disc were a hard structure and it could just slip out and slip back in, well, if that disc slipped too far backwards, it would shunt into your spinal cord and paralyze you. Now, thankfully, that very, very rarely happens, and that's the kind of medical emergency that orthopedic consultants and surgeons will address if somebody has disc material that really has started to compress into the spinal cord. There's a rare condition called Cordra-Quina syndrome, which we've discussed in a previous video. So just to set your mind at rest, if somebody says, oh, slip disc, you know in actual fact what they're talking about is more bulging disc material that's now spreading into the window that's occupied by a nerve. Okay, so slip disc, they don't just slide about. Okay, so hopefully this video has been of some interest to you, and you now have a better understanding of what a spinal disc is. It's not a simple hard structure that just skids about in the spine. It's heavily tethered to the vertebrae with ligaments. Okay, so that just gives you an understanding there of a spinal disc and this misnomer of slip disc. Okay, thank you for watching.